Okay, Kenneth, so I'm Matthew. I'm going to be a physiotherapist. We've had a referral from your GP because you've got osteoarthritis. So what he's wanting us to do is to come up with some form of treatment plan that's non-surgical and not drugs, anything like that, and no medication, so that you can kind of do yourself at home, so like a long-term management plan. So what I've done is I've thought of a few things, and I'm going to obviously just suggest them to you, and you can feel free to say now. We can kind of explore the avenues, but what I thought we'd do is we do a exercise program, so a two-part exercise program. Part one will be aerobic, so that would be working on your fitness. We'd start by walking, jogging on the treadmill, cross trainer, that kind of thing, to build up your exercise tolerance again, maintain your weight so that we're not putting extra load through the joints. And the strengthening program for the muscles around your hips, they'll provide extra support for the joint. Hopefully you won't feel as weak and the movement will become a bit better. So that's the first plan. We're not going to go through that today. We're going to go through what is called the TENS machine. This is the TENS machine. It's basically electrotherapy, which works by sticking electrodes onto you, and it has impulses into your body and hopefully combats the pain. So does that sound okay to talk through the TENS machine today? Okay. So as I said, the TENS machine is electrotherapy. It works by sending impulses into your body via electrodes, and works on quick nerve fibres. So it sends information really quickly to your spinal cord, quicker than the information is transmitted about pain. So it gets the spinal cord first and prevents any painful information being processed, so you don't feel the pain as much. In the long term, it works by stimulating your brain to produce drugs called opioids, which are fed down into your spinal column and prevent any painful information from being passed up the spinal column to the brain, so it's not processed, it's not felt. So that's basically how it works. What you'll feel is a gentle tingling sensation as we're using it. We're going to show you today conventional TENS. So I'll show you how to set the machine up, and I'll show you where to pop the electrodes, and we're going to send you away with that machine on a loan basis. Get you back in 2 weeks after you've had a play with it, and we'll see how that goes. Is that alright?
Yeah, that's fine.
So this is your TENS machine. There's the electrodes. So you've got various wires coming out the top. We're just going to show you with one circuit today. So we're just going to show you on your left-hand side, which is the troublesome side, but when you use it at home, you can use it on both sides. So you can clip the other wire in, and you can have it fitted on both sides. So it's, like I say, it's a small handheld machine. You'll fix this to your waistband or in your pocket, wherever. Discreet. You pop the electrodes on your skin, under your clothes, and nobody's got any clue that you're wearing it. So it's not invasive at all. It won't affect your day-to-day life, and you can use it while you're doing things to control your pain while you're doing things. Maybe enable you to do a little bit more than you have been doing at the minute. Or you can use it after you've done any exercise to really be paid for a bit after. Okay? So what we're going to do is we're going to show you conventional TENS. So that is for the middle. So the C, so you can flick leave on that switch for today. And the parameters change depending on which setting you have it on, but we'll talk through them at a later date. So for the purpose of this one, I've set it up already. So conventional TENS, you have a pulse width of 100. And a pulse rate of anything over 80. So we've gone for 95 just because that's marked on nice and easy. So that's how you set it up. So for the purpose of the next couple of weeks, you're going to leave it set up like that, and you're just going to fix the electrodes on. What it has is a burst mode, so it is on and off, and it prevents the nerve fibres from kind of accommodating to the fibres, and you get a long-term effect. So that's something that we'll explore next week, but I don't want to give you too much to think about right now. So yeah, and then you're just going to turn the right hand dial as you're looking at it on. So you just turn that on, turn it around until you feel a gentle tingling sensation. You might not need to go all the way to the top. Some people have different pain, different thresholds for it. Some people will feel it at 1, some people won't feel it until it gets to 8. But it doesn't need to be uncomfortable, just gentle tingling noise. Okay, so what I'm going to do is I'm going to ask you to have a lie on the bed on your left hand side, right hand side, facing away from me, and I'm going to show you where to put the electrodes. Okay. Okay, so normally when you'd apply these, you pop them on, you can find what's called your greater trochanter. So that's the big bony part of your hip, the part where your femur joins into the socket of the hip and forms your joint. So you're going to put an electrode 1 inch above, 1 inch below, and obviously normally you pop all the wires under your clothing and stuff, but for convenience and ease today, what we're going to do is I'm going to pop the electrodes on and then just connect the wires up. Not just above your clothes, and we can just kind of show you where to go with that. Okay, so what I'm going to do first is I'm going to find your greater trochanter, and that's the big bony bit on the side of your hip there. So if you just move your hip, we'll just make sure we've got it. There we go. So we're in there. Okay, so what we're going to do is we're going to pop an electrode 1 inch above, about there, and 1 inch below there. Okay. These are adhesive electrodes, so I'll just roll your shorts up for you. These are adhesive electrodes, so you just stick them back onto the pad when you're done. So we're going about 1 inch below, so we're there. In fact, we'll have it pointing upwards so that the wires are nice and neatly arranged. Okay, and then 1 inch above, so we're in there, and we'll pop it in there. Okay, so we've got the electrodes placed about 1 inch above, 1 inch below. The more effect is, they don't get closer than 1 inch together, the electrodes, make sure that they're no more than 1 inch apart, but the further apart you have them, the less effect they have, so try and concentrate as much into the hip as you can. Okay? And then what we do is we connect it up. Connect it up like that. Connect that one up like that. And then, as I say, you just flick the switch on. I'm not going to turn it on. I'll let you do that in your own time. So you just turn it on until you feel a gentle tingling noise, sensation, and then you can kind of clip that into your waistband somehow. Right. There we go. So you clip that in like that, kind of, and then you obviously you just turn it on and let it do its thing. Okay. So then to take the electrodes off, you turn it off, put it completely off. There's no electrical impulse going through them. Disconnect that. Disconnect that, and then you just pull the electrode. Don't pull by the wire. Just pull the electrodes off and pop them straight back onto the adhesive pad. So that's the adhesive pad that we've got for you. And then so what I'd advise you to do to start with is just to use the one hip. So the hip's the most painful. So this one's been long standing, so you can kind of get used to it. Next week we'll show you about how to place them on both sides and alternative placements and other modes of tens that we can use, and just a bit of trial and error really. What I want you to do is I want you to use it for 40 minutes to start with. That's kind of roughly the guidelines of research have shown that's the most effectiveness in terms of whilst you're doing the activity and the length of the pain relief after you've stopped using the tens. So I want you to try 40 minutes, but there's no cautions and contraindications in terms of how often you can use it. So just whenever you feel pain, pop it on and just see how you go with that. So we'll bring you back in 2 weeks. You'll have had a little play with the tens machine, seeing if it's for you and seeing if that's kind of how it works, if it's worked for you, and we'll kind of go from there and modify and alter from there.
Yeah.
Alright?
Thank you.